I'm also very thankful to be a Detroit native. And I called my dad before this call, and he said, yes, it is a nice, beautiful morning in Detroit, Michigan as well. And with us today, we have some amazing individuals who are going to be talking to us about the lead and copper rule. Prior to that, we want to make sure that we don't move forward without having an amazing, awesome technology expert who's going to help us to make sure that we do all the things right by our webinar this morning. We are at 7 attendees, and so this information we would be willing to share again prior to having our handbook intro. So right now we're going to have Alexis Smith with us from Freshwater Future to walk through webinar 101. Alexis, please.
Good morning, everyone. I'm going to share my screen really quick. Alrighty. So I'm sure everybody's been in enough webinars to know these few logistical details by now, but just to reiterate that if you are an attendee, you will be muted the whole time, and you will also not have access to your video. But if you have questions either during the presentation or afterwards, there is a Q&A box as well as a chat box that you can put comments and questions into the Q&A. If for further information, such as links to the information that we talk about today, like the Lead and Copper Handbook, you can find all of that information on the Freshwater Future website, which is here, www.freshwaterfuture.org. To open us up, Ms. Alicia asked if we would show a video from the Benton Harbor High School youth. So I'm going to go ahead and play that now.
So my city, we gon' make it bitch, education. I told my city, we gon' make it bitch, education.
I know you're gonna be alright. We're gonna stand tall for our rights. We can do anything. We can do anything. You gotta get up and put your hands in the air. You gotta get up and put your hands in the air. Say, I believe, I believe, I believe, I believe, oh, I believe. I believe.
Told my city we gon' make it, cause nobody will. Just be myself, don't smoke, don't drink, and I don't pop a pill. Stepped in the back so many times, I don't know how to feel. She said it's funny, youngest in the battlefield. Told my city we gon' make it, this our inspiration. And all we need is dedication with that education. My city striving for greatness, but we lose patience. Cause every time we see the news, why we the conversation. They always saying something bad and not congratulations. I guess they think we stupid, they think that we ruthless. We can make it out the trenches, I know we can do it. Yeah, I'm talking, walk the field and have them looking clueless. Chase your dreams and when you find them, make sure you pursue it. When you finally find your passion, it ain't nothing to it. Gaining hope is the key, make sure you don't lose it. Gaining hope is the key, make sure you don't lose it. Hey.
You gotta get up and put your hands in the air. You gotta get up and put your hands in the air. Say, I believe, I believe, I believe, I believe, oh, I believe, I believe.
Gotta focus, gotta get it in. This a real world, this is not pretend. Gotta move forward, even though there's haters. Get your education now and get your money later. Gotta get it, ain't no hesitation. But when it comes to life, I ain't got no patience. I be moving fast like the speed racer. Like an essay, I'm surrounded by paper. Staying in school even though it's hard, cause it's hard to ever finish if you never start. Even if I never ever make it, I know I got my education. To my city we gon' make it bitch, education. To my city we gon' make it bitch, education. To my city we gon' make it bitch, education.
You gotta get up and put your hands in the air. You gotta get up and put your hands in the air. Say I believe, I believe, I believe, I believe, I believe, I believe, yeah.
The demons are knocking, our city is burning, and we have no options. They do not care about our city, they do not show us no love. They just put us in their pockets. To the world, we do the most to them. To the world, we is a ghost to them. But I'ma make sure they hear my words. See, I'ma make sure they hear my verse. Cause we gon' blow up and fly like a bird. Yeah, I'ma blow up and fly like a bird. You cannot take me up out of my city. Move me, try me. 269 got the animals behind me. Cause honestly, you should be part of the movement. We making moves, we say goals. We gon' go for it. Just watch how it goes. Cause I'ma watch you on the sideline while we shine. You had the light, now the lights on mine. It's too bad cause we in control now. Education is a goal now. Cause we gon' be valedictorians. Cause we victorious. Yeah, we gon' be valedictorian. Cause we're victorious.
It's gonna be alright. We're gonna stand tall for our rights. We can do anything.
We can do anything.
We can do anything.
Yeah, we can do anything.
You gotta get up and put your hands in the air. You gotta get up and put your hands in the air. Say I believe, 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 yeah.
Wow. You just give those young people a hand. How simply amazing that they believe that even during these times, during the social unrest, through the water contamination and harm, that we can do anything, especially together. And at this time, I want to just take the time to say that I'm very thankful as in the staff in support of community engagement in Freshwater Future. I am so thankful to be under the direction of the next voice that you will hear. Director Jill Ryan has a heart for community, understands what the needs are, and does not apologize for kicking down doors and saying that this needs to be done and be done better. And with that being said, I introduce to you Jill Ryan, the Director of Freshwater Future.
Thank you so much, Alicia. What a nice introduction. I'm ecstatic that we're here together today, and I want to thank the Great Lakes Environmental Law Center. They've done such an amazing job creating this handbook that is so necessary right now as we learn more about communities that have high lead levels and what we can do about that. And so Freshwater Future is just, we're so grateful that they called on us as partners to get the word out about this book and help ensure that communities are able to utilize it and also have support. And so this is just the beginning. For Freshwater Future, we want to support everybody who comes onto these webinars so that we make sure you have the information you need and have the tools you need to make sure you have clean, safe, affordable water in your communities. As many of you may have noticed, in Michigan, we have a lot more communities that are suddenly out of compliance with the lead and copper rule. And in part, that is because Michigan has created a rule that causes us to do better testing. And that's a really good thing. But unfortunately, what we sometimes hear is that, but it's okay because it's really been that way. And that is not an okay excuse. The fact that it's been that way makes it all the more urgent for us to stop it. And so that's really why we're here together today, to make sure that where the lead is high, we're taking immediate and lasting steps to protect our residents and to get the lead out of the system. So I'm ecstatic to be here. I'm so glad we have all of you participating today. And we are excited to keep this process going and make sure that we're there with you over the coming months and even years to make sure that we have safety for our residents. With that, I am really happy to introduce Nicholas Leonard. He is the Executive Director of the Great Lakes Environmental Law Center, and he too has a huge heart for community and people. And I'm really thankful that he came up with this idea and invited us to participate. So with that, Nick, thank you.
Thanks, Jill. And it's really great to be here. And I'm really excited to talk with everybody about this. You know, we're a Detroit-based environmental law nonprofit. And so ever since countless, a pretty basic question about their drinking water. They basically, what residents want to know is my drinking water safe to drink? Should I be concerned about the levels of lead in my drinking water? Do I even know what the levels of lead in my drinking water are? And those are all very good questions, very simple questions. And unfortunately, there also can be very difficult questions for residents to get answers to. Because while we know that lead in drinking water is an enormous problem in Michigan communities, and we know that it's a problem that's gaining more attention, as Jill mentioned, as we get more data, more monitoring results, and that sort of thing. We also know that the regulation that regulates the amount of lead in drinking water, the Lead and Copper Rule, is a very complex regulation that's often just very difficult for even experts. And so we created the handbook with the hopes that essentially residents would be able to pursue some of those questions and get the answers that they wanted for basic questions like, is my water safe to drink? Should I be concerned about the level of lead in my drinking water? And to really empower residents to not just ask the right questions to the right people, but also to sort of do their own investigations, to submit your own Freedom of Information Act requests, to get public records, and things like that, and to also just know how this law works, and to know the specific points that you need to know about in order to feel empowered as a resident. And so that was the goal of the handbook, was to basically help residents be able to answer those questions and to know, to the extent that they can, is my water in my home safe for me and my family to drink? Because that's ultimately what this is all about. And everybody should, at the very least, be able to answer that question for themselves and their family. And obviously, we're here as a legal resource for people that have additional questions beyond, that if they sort of think something's going wrong in their community and they're not getting the answers that they need, or if they have questions about sort of the results that they're getting, or the and get the answers that you all deserve. And so we're very happy to be here, and thanks so much to Freshwater Future for pulling this together.
What a wonderful partner. I'm so very thankful for Nick and all of the hard work. What we know in American history is that everything is based in some type of legal language. And to have a nonprofit organization that cares so much about the environment to go into that language and pull it apart and help communities understand their rights and their duties in regards to environmental justice is so key. Thank you, Nick, for all the work that you do. I know that as our director is also has a legal background, it's helpful to be able to share that information with communities as we draw up community benefit agreements, as we prepare folks to do FOIAs. And I'm so thankful that I will be introducing Aaron, who is going to be talking in a great detail about the handbook. But before we go there, I am so excited to have our next speaker on with us. And there's going to be many more exciting moments with this beautiful and amazing young lady, Miss Amanda Heith, who is a microbiologist technician who knows all that there needs to be known about the harms and public health impact of lead. And so I am not going to prolong her introduction, but I'm so very thankful that she comes unapologetic, saying to community that these are the things you need to know about public health and the impact of lead. Miss Amanda, thank you for being with us today. You have the ability to share your screen if necessary, and we're now in your hands.
Good morning, everyone.
Good morning.
Okay, so the presentation today is lead and the public health impact. So why is lead exposure important to us? And it's important to us because it does have an impact on our health. So the health burden or health outcome of lead on populations most exposed are those populations that are vulnerable historically. So we're speaking about people who are in living conditions in lower income areas in different cities of the around the country, expectant mothers, children, minorities, and the elderly. So what exactly is lead? So lead is a naturally occurring earth metal, and in its whole form, it's also known as a mineral. Found in gasoline, paints, cosmetics, piping, and the piping that coats our water system. Lead is a mineral that our body is not able to metabolize functionally. So the federal government in the 1970s actually banned lead being used in gasoline, and also in 1978 it was banned from being used as a contaminant in household paint, which is a large portion of where children got exposed. It has a sweet taste, and children would suck and lick on the paint that would coat the walls in the homes, and that's how they would most commonly become exposed. The US EPA allows for a threshold or a maximum of 15 parts per billion of lead in 10% of residents that receive tap water. Before measurable actions must be taken by a municipality. Now, this is interesting because the National Institute of Health actually says that there is no acceptable or safe level of lead exposure. So why is lead bad for our health? Well, lead, as I mentioned before, is a naturally occurring mineral, and our body uses many different minerals, copper, zinc, selenium, to carry out our processes that keep us healthy. When lead is broken down into our bodies, it goes directly to our bloodstream. Our blood system supplies every ounce of our body. And what happens is the lead itself actually displaces the healthy minerals that actually our body uses. So I think of it as mineral musical chairs, as I like to say. So where there's only so many spaces for our minerals in our body to carry out its processes. So lead actually takes the place of a helpful mineral, and then that helpful mineral is not able to be used properly. Okay, so can we get sick from lead exposure? Absolutely. So elevated lead levels are present in the blood. It's often done by blood testing in a lab, such as the one I work in. Physical and mental delays and developmental issues are what we see in children most commonly who are exposed. Other populations, as I mentioned before, that would be vulnerable are pregnant and expectant mothers. So this outcome leads to low birth rate of children and decreased fetal development of the expectant mothers. For other adults, cardiovascular disease, decreased kidney function, and nervous system degeneration are some of the health impacts that we see in people who have these unacceptable levels of lead exposure. Let's see. So children are most vulnerable to lead exposure because their bodies are still developing. The lead actually gets metabolized and it can even be stored in their bones and teeth. And our blood is actually made in our bone, and that's how it is able to go past the blood-brain barrier and become a neurotoxin. Because lead enters the blood, lead levels um, above 15 micrograms per deciliter are the levels that are associated with the cardiovascular disease that we do see in adults, and levels as low as 5 micrograms per deciliter are associated with fetal development as well as nervous system degeneration. So these are not high levels that we're talking about. These are actually levels that are lower than what the EPA recommends that actually cause disease. So who is most at risk? As I mentioned before, children, expectant mothers, people who live in homes in low income communities or in rural communities, minorities, and industrial workers. And I put industrial workers because the lead is present in particulate matter, so like dust size matter. For people who work in the industrial industry, they inhale it, and then it does get metabolized and it gets put into their bloodstream. So why are these populations most vulnerable? Well, because as I mentioned before, lead is a mineral. Oftentimes people in these communities, children, expectant mothers, because the fetus is feeding off of that body, and people in low income communities because they're in food deserts, right? People in lower income communities and minorities, sometimes we don't have the best access to proper food. And as we know, fresh water. Children are still growing, so they need the most nutrients. So what happens is when we're malnourished, again, that mineral has the ability to displace healthy minerals that we're already deficient in. Older housing Older housing also sometimes doesn't have the proper renovation that allows those lead paints to have been removed. So people who live in older buildings are exposed by either particulates, the dust matter from those old paints, or in our case, the old lead laced piping where the water is actually allowing the lead to leach into the source of their water. And that water is used for cooking, bathing, and then it absorbs in the skin. When we consume it, it gets digested, and both ways it does become metabolized and goes through our bloodstream, which goes through every system in our body. So we just want to think about the importance of lead as it does have an impact on us directly. And because it does affect our health, the health of our children, the health of our parents and grandparents, we do need to take a active role in ensuring that the levels are lower than what the national standard is saying they are. Because even at lower levels, we're seeing disease, morbidity, and mortality.
Wow, wonderful. Thank you so much, Amanda. It's so important for us to many times. So what does this have to do with me? So okay, it's lead. But as you heard Amanda share with us, that it is in every aspect of our lives. Many of us that are living in low socioeconomic communities, it is in our homes, in the paint, in the lead lines that are delivering our water to us. And this is why it was so important for the Great Lakes Law Environmental Center to do this work of this handbook, to teach us how to take community action, how to be a voice for those that are voiceless. And I'm so very thankful to be able to introduce our next speaker, who this man has been just that, the voice for the silent, and then teaching those that have a minimum voice to elevate their voice. And so with that being said, I introduce to many of you the honorable, beloved Reverend Edward Pinckney, all the way from Benton Harbor. Reverend Pinckney, please speak to us. You're muted, Pastor.
First of all, I want to say thank you, Elisa. I want to thank you for all you have done for Benton Harbor, you and Jill, because without you two, Benton Harbor would not even know, or would not even announce that they had a water problem, a lead problem here, because they had concealed it for so long. But immediately when y'all stepped in, we went to work, and now we almost got it under control, at least the workers. So that's where we at now. But let me tell you some of the stuff that we done. I'll start off with the water filters. We had passed out over 1,000 water filters and replacement to the community on 3 different times. We call it the drive-by. And my children, I call them my children because they're younger folks. And what they do, they get out there and they teach Barron County Health Department on what needs to be done, because they had no idea, because they had no relationship with the residents of Benton Harbor. When you don't have a relationship with people, you don't know what to do. But these young folks, they knew exactly what to do. They went out there when we did we call it a drive-by. And what we do there, drive-by, we'll give them the filter, and we didn't ask all them questions like they want to know why, do you have one? Yeah, they got one. That's why they're here. They didn't have if they had one, they wouldn't be here asking for one. So that's one of the things that we wanted to teach them. Then we also passed out about 2,500 door knockers. Every single family in Benton Harbor had a door knocker telling them when we're going to be passing out the filter and what we was going to be doing. So to me, that was even more important because they saw us actually working. So the health department asked, how do y'all do this? How do y'all get people to come like this? I said, we do it by working. And we do it by caring for our community. And that's the only way that you're going to get things done, by caring. You got to have a heart for the community in order to be successful. And their idea was that, if they come, they come. We don't care whether, no, not with me. If you got something that you want to give that's going to help this community, I'm going to make sure you do it right. And that's one of the things that they found out. They said, well, you working us too hard. It's too many people coming. I said, it's never too many people. I want more to come. I was out in the street stopping people, pulling them in. And they would say, now this is too much work. And sometimes we're supposed to be from 3 to 6. We didn't leave there until 7 o'clock, and which was even more important. But now with the young folks, they so involved. And what they're doing, they're educating other people about the condition of the water. You see, because that's crucial. One of the things we always have our masks on and our gloves on. We go door to door and we find out who need a water filter, who don't have one. And then we have to call the health department in order to get one. So we do that. But here's something that just happened. We just had a breach in our water at the plant, because they always tell me it's not at the plant. It's in the pipes at going into the house. But now we discovered, we got a problem right inside the water plant. And it could have been corrected, but negligence, that's what it was. Negligence on their part, because they didn't care enough for the people to do it right. So we immediately went in and stopped it. And we're doing the water testing now. We got up to 52, but the point is, we have to make sure they're doing what's right. What I did for O'Malley before he got fired, I went in there and tried to organize his paperwork, because his paperwork was not up to date. And then he didn't want my children to come in there, which I can understand that he's supposed to be such a private thing. But what we did, we went in there and helped him organize his paperwork. It was so bad that, it took us days. I spent 3-4 hours over there helping him do what he's doing, and he's getting paid and I'm not getting paid. And they didn't even want to give us gas money. for doing the thing. But my children, they have just been sensational. They have just been doing the thing. I awarded each one of them $300 this past week to show them how much we appreciated them and the work that they have been doing. I am so excited to have a team like this who can actually do the work and willing to do the work for free. And to me, that's crucial. And I appreciate them so much. So I'm going to close by saying, we're going to keep the pressure on them. We're going to make them do what's right. And we're going to make them do what's right in reference to this water issue that we have in the city of Benton Harbor.
Wow. Wow. Thank you. Thank you so much, Pastor. Thank you to the community, the children on the ground, the individuals who are being directly impacted, standing up, being heard, doing the work. Thank you so much, Pastor. We got to get up and put ourselves.
That's right.
The children started us off that way. Thank you so much.
Yeah.
I am so very thankful that this team has come together to do this work. And we could not have done this handbook or even exposed families and communities to this handbook without the amazing staff and director of the Great Lakes Law Environmental Center. And right now, I am honored to introduce the staff attorney, Aaron, over at the Law Center. Aaron, please share with us, teach us. Everyone had, all of the panelists and the guests have their handbooks. We are ready to learn. We are waiting for you to teach. Let's go, Aaron.
Thank you so much. I love this enthusiasm. Hi, everyone. Thanks so much for being here. And it's such an honor to be able to talk about our handbook with this great team of activists. Again, my name is Erin Meddy, and yeah, I'm a staff attorney at the Great Lakes Environmental Law Center. And today I'm just going to be giving you a little bit of background information about Michigan's Lead and Copper Rule, what it requires of drinking water systems, and really sharing how to use this Michigan Lead and Copper Rule Handbook to investigate the safety of your drinking water. You know, it often to me feels like we residents shouldn't be the ones that are responsible for making sure their drinking water is safe, but you know, that's the reality we're in, and our goal is to make sure that you feel empowered to do that, and we hope that the handbook will be a good tool for that. So I'm just going to share my screen here. I'm going to be walking through the handbook itself, and if you have a copy of the handbook, I think the link has been shared. You know, feel free to follow along and note any questions that you might have. If you have questions while I'm talking, you can drop them into the chat, and we'll definitely have time at the end for questions as well. So just a little bit of background about how this handbook came to be. Over the course of about a year, we at the Great Lakes Environmental Law Center, we submitted over 70 Freedom of Information Act or FOIA requests to the state of Michigan and to local water departments to see how the revisions that were made to the back in 2018 to Michigan's Lead and Copper Rule were being implemented. And I'll talk a lot about what the Freedom of Information Act is and how you can submit requests to get this kind of information. And when we were doing these requests, we focused on 3 representative water systems, Southfield, Beverly Hills, and Kalamazoo. And we were really looking for records that pertain to their lead and copper rule monitoring and corrosion control efforts. And so following that audit, we produced this handbook. Let me see, I want to make sure that, okay, I think we got it. So we, as Nick mentioned earlier on in the presentation, we prepared this handbook as a free public resource to really empower resident watchdogs to conduct their own investigation of their water system, just by enabling folks to get the important information and really to ask the right questions. It's okay if you don't have all the information right away, but hopefully this can help you figure out what questions to ask. And so we hope you'll be prepared to begin your own investigations of your own water department and really hold them accountable. you know, they have a responsibility to protect your drinking water, but we have a lot of power to make sure that they're doing that. So these are throughout the book, there are steps that you can, as a resident, can take, and really that you have a right to take under the law, under the Lead and Copper Rule. So we're hoping it's an easy tool to use, and it'll inform you of your rights and give you more control over the safety of your drinking water. And it is a lot of information, and although we tried to make it not you know, a really formal legal document with lots of legal language, we're definitely available to answer more questions as you're using this. And if you need help submitting FOIA requests or writing them, you know, we're always available to help out with that. So a little bit about the structure of the handbook itself. There's really 6 main sections that correspond to different sections of the Lead and Copper Rule. So the sections cover really how to identify lead service lines and monitor for lead in your drinking water, what happens if the lead level is too high, and what water systems are required to do in terms of communicating with the public and preventing corrosion control of lead into water and replacing lead service lines. So each section has information about what water systems are required to do under the Lead and Copper Rule, actions you can take as residents, and sample FOIA requests, as well as examples of records that you would receive from those FOIA requests. So before we dive into the details of each section, I'm going to back up a little bit and talk about what the Lead and Copper Rule is and what the Freedom of Information Act is. So that's these are really 2 key laws or regulations that help us do our job to protect drinking water. So the main source of lead in drinking water is lead in water service lines. So these are the water pipes that connect a water main to household plumbing and household plumbing. So when water runs through service lines and household plumbing that contains lead, the lead might be released into the drinking water. And so the Federal Environmental Protection Agency, or the EPA's Lead and Copper Rule is really the key regulation that limits the amount of lead in drinking water that's provided by water utilities. And this rule, this Lead and Copper Rule, really just provides a baseline, and then individual states are allowed to make stronger regulations to sort of go above that baseline in limiting the amount of lead in water. But most states have just adopted the federal rule. And for a long time, the EPA's Lead and Copper Rule has really been criticized for not being protective of consumers from exposure to lead. As Amanda said, you know, we have this certain baseline amount of lead that's allowed in drinking water, but it doesn't mean that that's a safe level of lead to consume. There is no safe level of lead. The only amount of lead we really want in water is 0. But back in 2018, largely in response to the Flint water crisis, the Michigan Department of Environment, Great Lakes and Energy, it was the MDEQ at the time, significantly revised Michigan's Lead and Copper Rule to make it more protective than the EPA's rule. So it's not perfect, but it's a little bit better than that federal rule. So some of those key changes include lowering the lead action level, the amount of lead that's allowed in water, from 15 parts per billion to 12 parts per billion, requiring a lead service line inventory by each water utility and full lead service line replacement for all Michigan properties over the next basically 20 years. And then also changing the requirements for sampling of water to change how we're testing for lead in water. So as I mentioned before, the Michigan Lead and Copper relies on 6 core requirements that sort of correspond with the sections in this handbook. And so those are laid out here in this little box on this page. So that includes identifying lead service lines, tap monitoring, lead action level response, public education, corrosion control, and lead service line removal. And all of these really, these requirements have to be working together to make sure that our water is safe. you know, it's not enough if one piece is missing. We really need all of them to be working in order to protect our drinking water. Next, I wanted to talk a little bit about the Freedom of Information Act. I'll be using the term FOIA a lot throughout the presentation. So that what that means is the Freedom of Information Act. And so this is a law that requires government bodies to provide residents with any public records that they request, subject to a few exceptions. Oops, one second. Okay. And the LCR requires local water departments and EGLE to keep a lot of public records regarding lead in drinking water, which residents can then request through a FOIA request. And some of these records include results of lead monitoring, the preliminary and complete distribution systems materials inventories, which is a big term, but I'm going to be talking a little bit more about that and what that means in a bit. Corrosion control studies that are used by the water system to identify treatment techniques to limit the amount of lead in drinking water. Reports about the number of lead service lines in your water system, and the ones that have already been replaced and those that need to be replaced. And also just emails sent or received by your water department or EGLE regarding lead in drinking water. So those communications between those government bodies are all public records. So if you want to submit a FOIA request, here there's a bit of information about what to include in your request and how to submit it. But essentially, the request just has to be in writing, and you just want to make it as specific as possible so that the government body can find the records you're looking for. And that especially includes making sure you include the date range for the records that you're looking for, to limit it to you know, the amount of time that you want the government body to search through those records. For the purposes of the Lead and Copper Rule, basically all of your requests would be directed to EGLE, your local water department, or both. Often certain records are kept by both government bodies. EGLE has its own online system for submitting FOIA requests, as you can see right here. And then when it comes to submitting requests to the water department, some larger systems will have their own FOIA coordinator that works just for the water department. But if not, there's usually a FOIA coordinator for the city itself that sort of oversees the different departments. So you could submit a request to them as well. Once they receive the request, the government body is supposed to respond within 5 business days, but they often claim an additional 10 business day extension. That's pretty common. You also might be charged a fee for your request, but the government body has to give you a detailed itemized invoice before it will charge you a fee. So you can receive the invoice. You can sometimes tweak the request that you're making to make it a little bit more targeted and reduce the cost before they actually go out and do the search for you. And there are some discounts available as well, like the indigent persons discount, which covers the first $20 of the fee. And there's also a public interest waiver if the government body decides that providing the record is in the public interest. But it's rare that they grant that particular discount. And usually the records are provided either by mail or email, and sometimes they're just made available at the government office for in-person review. So we're going to jump right into the first section here about identifying lead service lines in drinking water systems. So as I mentioned previously, the largest source of lead in drinking water are lead service lines, which are the pipes that connect water mains to houses and buildings, and lead pipes and lead solder, which are sometimes found in household plumbing. So the lead in these service lines and in plumbing can dissolve and release into the water over time, release lead into the water over time through corrosion, and then enter that drinking water system in that building. So unfortunately, many water departments don't actually know where all of these lead service lines are, where they're located throughout the system. There can be thousands, throughout a system. And so in order to address this, the Michigan's revised lead and copper rule requires each water department to go out and identify where all of these lead service lines are located by completing both a preliminary distribution system materials inventory and a complete distribution system materials inventory. And the preliminary inventory is just kind of as it sounds. It just describes what the water system does already know about the number and location of lead service lines that are based on their existing records. And these preliminary inventories were actually due to Eagle back in January of this year. And the complete inventory is due in January of 2025. And that really requires water systems to go out and identify the materials in all of their service lines so that they have a more complete picture of where those risks are. So this first section really covers the methods that water departments use to identify those lead service lines, and that you can, in some cases, use to see if you have a lead service line in your home, and the requirement for water departments to notify households that are connected to a lead service line if they find that that's the case. So the three key methods for identifying that water systems use to identify lead service lines include just looking at the existing paper records that they have. Sometimes these are very old records and not very complete, but sometimes there is information there that can be helpful. So that's sort of the first step, and obviously that's the easiest way to do it if those records are available. The next method is just looking at the portion of the line that enters the house. This is often in the basement. You can see some pictures here of what lead service lines entering the household might look like, and they have some different tests for inspecting the color, whether it's magnetic or not. They have a few different methods for looking at those service lines entering the household. And then finally, the sort of the most difficult but also the most effective way of identifying is just digging up the area around the water service box, sometimes called the shutoff valve, in the yard to look at the line. If the water system, the water department can't figure out what material the line is made of, or if they do identify it as lead, then they have to notify the household where that service line is. Let the people living in the house know that there is a lead service line and that there are risks that come along with that. So some actions that you can take. One thing you can do is review your water department's preliminary distribution system materials inventory. Your water system might be is likely still in the process of completing the more final complete inventory, but you could submit a FOIA request to the water department to take a look at that preliminary inventory, and also encourage them to conduct the complete inventory as quickly as possible. And so we have some sample language here for a FOIA request so that you can access those records. And if you do submit a FOIA request, this is what you will likely receive as a record. So this is a preliminary distribution system materials inventory. This is an example from Southfield. And so this shows what the water system has to report to Eagle. This is the information that they have to go out, at least initially, to report to the state. And in the next section, we're going to talk a bit about monitoring lead levels in tap water. Beyond just identifying whether there's lead service lines, it's important to know whether that lead is actually getting into the drinking water. So because of the there's just a huge number of possible lead service lines in many water systems. And there are a lot of factors that can affect how and when lead is released into the water. There's a lot of variability there. It's really just not possible for water departments to consistently test every single household's water for lead. So instead, what the Lead and Copper Rule requires is that water departments take water samples from a limited number of household taps, specifically those with the highest risk for lead contamination, and then test those samples for lead. So this section on monitoring covers how water departments select those households for sampling, how frequently they have to collect samples, the number of households that they have to take samples from, and then how they collect those samples, the protocol and requirements for collecting those samples. In terms of selecting households for tap sampling, water systems have to use a tiering system essentially, and this figure B1 kind of gives a good overview of the different tiers that water systems use. Tier 1 includes single family homes that have lead pipes or are connected to lead service lines. These are the homes that they have to sample first. And if there aren't enough of these tier 1 sites that they can go to, then they move on to tier 2 sites. And if not enough tier 2s, then tier 3s and so on. And water departments are required to collect tap samples from a limited number of households to test for drinking water during each specified sampling period. And the sampling period really depends on the size of the water system and their history of compliance with the lead action level, whether they've always been in compliance or whether they have had elevated lead levels that they've found, whether they've exceeded that lead action level. So when they're sampling for water, I'm just going to back up a bit. So typically the water systems will have to sample every 6 months. That's sort of the standard period. There's the chart. Here we go. This standard sampling period is every 6 months. But this is most water systems are actually on a reduced sampling period, so they only have to sample once per year. So that's the most common. And the number of households that a water department must collect samples from depends on the number of people that are served by the water system, as well as sorry, losing my train of thought here. The number of people that are served by the water system. So if a water system has remained below the lead action level for 2 consecutive standard sampling periods, it's eligible to reduce its number of sampling sites. And most water utilities in Michigan do qualify for that reduced number of sampling sites, unless they've recently exceeded the lead action level, as I previously described. So a little bit more about the procedures that they use. Water departments can either have its staff collect tap samples, or they can have a resident living at the household that's serving as a sampling site collect the tap samples. But either way, the person sampling has to follow very specific procedures. And after the testing, water systems then have to notify the resident of the results of the test in a consumer notice. And that describes just the amount of lead found in each sample and steps that residents can then take for reducing their lead exposure. Let's take a look at the consumer notice. So this chart here kind of breaks down what you would see in the consumer notice, depending on the level of lead that may be found in that sample. And we also include, again, more actions that you can take regarding lead sampling. If you think you have a lead service line, you can contact your water department and ask that your home be included in the sampling pool, and that they take tap samples from your home during the next sampling period. So that's a really direct way. You know that your household is being included in that testing. You can also review the water department's tap sample results to see the range of lead results from different households for both the 1st and 5th liter sample. So when water departments are sampling, they have to take basically 2 liters of water to sample. And you can request the water system sampling procedure instructions from your water department to see how they go about doing the sampling, or if you want to do the sampling yourself. And then if your home is tested, you can request the consumer notice if they don't provide it to you right away within 1 month, as they're supposed to. And here, again, we have some examples of records that you might receive if you submit a FOIA request. The lead and copper report and consumer notice for the community water supply. And these records, here's a consumer notice. So this is what you would receive if there was sampling done at your home and lead, if any lead was found, this is the report that you would receive. Here's a bit more detail about the instructions. As I said, the sampling would come from the 1st liter and then the 5th liter to see, what's coming out of that tap initially and what's coming out after the water has been running for a little while. And so they give pretty detailed instructions for how to go about doing that sampling. Let's see. I won't spend too much time on all of those records, but if you do receive a consumer notice and you have a question about it, again, feel free to reference the handbook and reach out to us if there's anything that's unclear. We're happy to review individual reports that you might receive with you. I'm going to talk next a little bit about the lead action level. At the end of these sampling periods that we've just talked about, EGLE has to consider all of the monitoring results together and then determine if that water system has exceeded the lead action level. So as I said, it's currently set at 15 parts per billion. Based on the new rule, it's going to be lowered to 12 parts per billion, but that won't kick in until 2025. So after the water system collects samples, they send them to EGLE. EGLE then calculates what's called the 90th percentile of the results. And if the 90th percentile exceeds that lead action level, then the water department has to take different actions to warn residents about lead in drinking water and to actually take steps to lower the amount of lead in drinking water. So as it's outlined above here, this section really covers what your water department has to do if it exceeds that lead action level, including issuing a public advisory within 3 business days of receiving the notice that the action level has been exceeded, deliver public education materials to customers, engage in lead service line replacement at a more rapid pace. They're already required to replace lead service lines, but that sort of kicks up the speed of that replacement, and offer to arrange for sampling of tap water for any customer who requests it, and then assessing their corrosion control treatment. So that the treatment that they're putting into the water to make sure that lead isn't leaching out of the pipes. So things that you can do in terms of monitoring lead action levels is checking your water department's latest consumer confidence report, which is sometimes called the water quality report, to see what the 90th percentile was during your department's last sampling period. You can notify your water department if your water system has exceeded the lead action level, but you didn't receive the public health advisory that they're required to send out to you. And you can also submit a FOIA request for your water department's public health advisories and public education materials. So anything that they have sent out in the past, you can request those. And again, we have sample FOIA requests, language that you can use to submit those requests to your water department. And again, these are some of these requirements for what the water system has to do if that lead action level is exceeded. Here's these records are that public education again that the water department is required to send out. So that's what that might look like if your city sends this out. This is a sample from Hamtramck. We're going to dive into a bit more detail about public education. So as I said, all water departments are required to provide their residents with specific information so that residents can really be aware of the risks of lead in drinking water and take action. And this information that water departments have to send out include providing the annual consumer confidence or water quality reports to all households. And if the water system serves 50,000 or more people, they have to form a water system advisory council to advise the public water system about ways to engage the public in issues related to drinking water safety, and particularly to lead in drinking water. So here's a bit more information about these consumer confidence reports. Water departments are required to directly deliver the consumer confidence report to all customers by July 1st of each year. And the specific information that needs to be included in these reports include the number of lead service lines, that 90th percentile value for lead, that we talked about in the sampling procedure, and the number of sites that exceeded the lead action level. And then they also have to provide information about opportunities for public participation in decision-making related to water quality. There's a statewide drinking water advisory council that was appointed by Eagle. And then certain water systems, there's a list here of water systems that have these advisory councils as well, and based on the size of the population that they serve. So your water system might be on this list. And if so, those water system advisory councils can be a great resource for getting more information about your drinking water. And here's just some best practices that Eagle provides for those advisory councils, including like how many members are supposed to be appointed and who is being represented in those councils. They're supposed to be representative of the community being affected, of course. That's why they exist. Next, we have a bit of information about corrosion control treatment. So this is, how departments prevent lead from, or try to prevent lead from leaching into water. So, in order to really control the corrosion of lead service lines, some water departments have to introduce a corrosion control treatment to their water supply. And this commonly involves adding a chemical to the water supply at the water treatment plant itself to limit that corrosion of lead into drinking water primarily from lead service lines. But it's important to keep in mind that even the most effective corrosion control treatment doesn't eliminate lead contamination in drinking water. It really just reduces it. So this section, as it states here, really covers, which water departments are required to use corrosion control treatment. Not all are. The different methods of corrosion control treatment, and how the departments pick which method to use, which one they think will be most effective, and then how water departments make sure that treatment is actually working and doing what it's supposed to do. So in terms of who actually has to use corrosion control, any water system that serves more than 50,000 people has to use corrosion control. And as well as departments that serve less than that, that number of people, but they've exceeded the lead action level, then there's that concern that that the water system, needs that extra treatment to make sure that that leaching doesn't continue. And there's really a pretty wide variety of corrosion control treatment methods, and water systems are responsible for evaluating the effectiveness of basically three key key treatments and picking which one works best for their system. So in order to do that, they have to conduct a corrosion control study. And so based on the results of that study, then EGLE designates a minimum value or range of values for a variety of water control parameters. And again, as in every section, I think the most important is just actions that you can take. A lot of it's pretty dense information, especially when you get into things like corrosion control. Even I'm a lawyer, not a scientist, and so I'm still learning the science behind some of the corrosion control treatment methods. But the key is just making sure you know what's going on in your water system, and that your water department is doing all it can to reduce the corrosion of lead service lines. So one action that you can take is asking your water department what your water system's designated optimal corrosion control treatment method is. So what method are they actually using? And then requesting the corrosion control studies from EGLE. So what the results are from your water system of those studies. And then finally, I'm going to talk a bit about lead service line removal and replacement. This was a big change in the revised lead and copper rule, in requiring that water systems replace all lead service lines. As I said, corrosion control helps reduce lead, but it's not, it doesn't completely eliminate lead in drinking water. So the only way to totally prevent lead from getting into drinking water is to get lead out of our infrastructure. Despite that, we know that we need to get these lead service lines out. The process of getting those out is really important as well. It's really important the lead service lines be removed in the proper way. And if it's not, that can actually create more problems. It can actually increase the level of lead contamination in the home if the service line isn't removed correctly. So this section really covers the requirements of Michigan's lead and copper rule, as we state here. The requirement that they replace all lead service lines at an average rate of 5% per year at the water department's expense. That's important to note that this is the responsibility of water departments. They have to do that by 2041. We wish it could happen today. We wish it should have happened a long time ago, but they have until 2041 to take out the lead service lines. And there's also a requirement that they replace lead service lines at a rate of 7% per year if the water system has exceeded that lead action level, and until the water system is then below the lead action level after another sampling period. And finally, their water systems are required to replace the entire rather than just part of a lead service line, except in emergency situations. So again, that's where the importance of doing this properly really comes in. Partial lead service line replacements where you dig up just part of a line, cut into it, and replace part of the line that can actually disturb the pipes that are remaining in the ground and kick up more lead, and then more lead gets into the drinking water and becomes even less safe than it was before the work was started. There's a really great, this kind of gives a clear picture of what lead service lines actually look like. That's that curb stop that we were talking about before, where water systems will sometimes dig up around there to identify whether it's lead. So it's replacing this entire lead service line. That's a requirement of the lead and copper rule. You don't want to just cut. Some water systems have argued that they are only responsible for this public portion of the lead service line, but they're actually responsible for replacing the entire thing, even that the portion that runs under private property. So again, actions that you can take and sample FOIA requests that you could submit. You can ask your water department if your home has a service line that must be replaced, based on those investigations that we talked about earlier, where they have to identify the material that the service line is made of. And if you see what you suspect is a lead service line in your home, you can contact your water department and have them come out and look and replace the lead service line. And you can also request from Eagle your water system's annual report that summarizes all the service line repairs and replacements that they've done. And again, there's language here for those requests. So those are kind of the key sections of the handbook. It's we hope that it's a fairly easy to use tool, but if it is at times a little dense, and if you have specific questions about submitting a FOIA request, or what sort of information you're looking for in your FOIA request, please don't hesitate to reach out to us, and we can walk you through it. I want to make sure that we leave plenty of time for questions, because I know that will hopefully be most helpful, helping you figure out where specifically you might have questions about the handbook. So thank you again.
No, thank you, Erin. Thank you so much. Please, Erin, feel free to put your contact information in the chat.
Yeah.
Where you would want young people to, or our audience to contact you. This is amazing, an amazing tool for such a wonderful state. Michigan sits around so much of the fresh water that we have in our country. And to protect that water, to protect the people consuming that water due to infrastructure disparities is so very important. So thank you, Erin, for that. I hope that everyone did their homework and had plenty of questions. I do see some questions in the chat box, as well as questions in the Q&A. And so Jill said that she would provide an answer, she and Nick together. And so we're going to come back on. Everyone's going to come back on and get ready to answer some of the questions. We have a couple questions in the chat box. And so Jill, are you with us?
Yes, ma'am.
Wonderful. So
I was getting reconnected.
Wonderful. So we're going to start with the question that came from Benton Harbor. It says Benton Harbor has less than 10,000 residents, but it is required to do 60 samples. Why is that?
So my understanding is that is because Benton Harbor is out of compliance with the lead and copper rule. And so then the state steps in and asks for additional sampling to try and get a handle on the problem. And they probably won't be able to scale back that testing until they show for 2 consecutive testing cycles that they're in compliance. And so far that they're not close to that. But I may be wrong there, so I'll let Nick elaborate if he has anything.
Yeah, so what you'll commonly see sometimes in places that are having sort of what I call habitual problems complying with the lead and copper rule is, the state coming in and saying you have to do something extra beyond sort of the plain language of the rule. And so I'm not sure, I haven't seen any, typically what that looks like is an administrative order from the state. And I haven't seen anything like that for Benton Harbor. It doesn't mean it doesn't exist. It just means I haven't seen it. That's one thing. Another thing is sometimes, cities' water systems will just take the extra samples and just do it anyway. Now they can be good. Sometimes it can reveal sort of additional problems, but it can also cut the other way. Sometimes it can sort of essentially dilute the samples and lower that 90th percentile by sort of taking more samples at sites that are of lesser risk. And so those are the 2 situations where we see communities going above what the rule specifies as their mandatory sampling site numbers.
Okay,
and
wonderful.
just to be clear, there is an order for Benton Harbor, although we have not been able to see that it has been signed. There's been negotiation between the city and the state. But it does include doing at least 60 samples every 6 months.
To which, Pastor, you have done what, 52? The
so
community
far
has taken that
52.
action.
So, but we're going to do about close to 70 just to make sure, just in case some of them be rejected, because according to O'Malley, he was very upset because he said we should only be doing 40, but yet they got us doing 60. And I said, well, whatever they required us to do, let's do it, and then we'll talk about it later. I said, because if we have our paperwork together, that's why I was helping him with his paperwork to make sure that it's in order, because I think that was one of the problems also. Too junky. You would, you just wouldn't believe it. Like I told him, I can't find nothing in here. He said, well, you got to know what you're looking for. I said, no, it should be right there so we can see it. So that way, if someone came in and replaced you, they'll know exactly what to do. You see,
That's
so
right.
we was working on that, and I would spend maybe 2-3 hours with him just to make sure that we get it in order and be typed up and be placed on the computer. So we don't have it in order since he's not there anymore. And but now we have opportunity to get it in order the way it should be done, because I've been talking to the secretary, and they got a guy from Flint there. He's handling O'Malley position as of now.
So just so that our audience knows, O'Malley is and was the water superintendent in Benton Harbor. Nick, I see, did you want to say anything to Reverend statements? Okay.
No, that's fine.
All right. Jill, if you would, we have 2 questions, 3 now in the Q&A. Would you read those questions for us, and then we'll provide questions to whomever in the panelists who can answer it.
Let's see. Sorry, I was in the chat instead of the Q&A. Now I see it.
That's okay.
All right. So from Ben Polly, we have a question for Aaron. He says, here in Flint, we are actively replacing our lead service lines, as you know. While this is arguably the most effective way of addressing lead and water contamination at its root, it ironically makes compliance with the federal lead and copper rule even more difficult, because the pool of tier 1 homes keeps shrinking, making it ever more difficult to collect the right kind of samples for monitoring purposes. This is the main reason why Flint remains in violation of the Safe Drinking Water Act, despite having made progress in reducing lead levels. It seems clear that an emphasis on lead service line replacement will require us to change our monitoring paradigm. In your view, does the new Michigan Safe Drinking Water Act, which obviously requires municipalities to progressively remove the lead service lines, adequately reconcile its prioritization of replacement with the needs for rigorous monitoring?
Yeah, that's an interesting question. I am not sure. I don't know if it really reconciles that that sort of conflict. I don't know, Nick, do you have a clearer picture of that?
Yeah, I think it does. I think sort of it takes, what Michigan's Lead and Copper Rule did was obviously, introduce a more comprehensive lead service line removal requirement, which was really important. And then it also essentially sort of tightened up the priorities for monitoring to make sure that they were happening at those higher risk sites. Now, ideally, you do want to get less of those sort of like higher risk sites to sample from. But at the same time, if there are some remaining, you want to sort of keep sampling at those. But as you're sort of going down and you're eliminating those higher risk sites, say, a home with a lead service line, that should mean that you should start to see some of your lead results coming down, because like, say you had a community, now that's going to take some time for a lot of these communities, because in a community like Flint, there were undoubtedly thousands of lead service lines. And so when we're talking about sampling pools and taking samples from homes, we're talking about sampling from 50, 100 homes, not all of that many in terms of the broader context. But as you're sort of getting those down, now you may start to see sort of some communities taking samples from lower risk sites, so sites that don't necessarily have a lead service line, and hopefully that would start to show lower, lead amounts in from those samples. So I think, what monitoring does, and this is important to remember, is just sort of give you a snapshot of the problem from ideally the highest risk sites, and let you know if the treatment is working well or not at that particular moment in time. But what we don't know is what's happening outside of that moment of time, and that's why removal of the lead service lines is ultimately important, because we know lead concentrations in water can vary. It can go up and down based on season, based on construction work that's going on outside of your house, based on water flow, the rates of water flow through your house. And so, it's just, there's a lot of unknowns, and that treatment isn't particularly effective for all of those unknowns. And so that's why the lead service line replacement requirement is so important. I hope I answered that question effectively. If not, we can maybe follow up.
And if I appreciate that, Nick. I think you're right on. And I also would add that as those service lines are removed and you get down to fewer numbers, it's really still critically important, because what we forget is that all that the lead and copper rule is monitoring for is whether corrosion control is working. It's not about health. It's not about anything else. It's about, is that corrosion control working? And even though you may have only 100 or 200 or however many service lines left, you have to make sure that those people are being protected. And they may not be close to the plant. They may not be getting the biggest dose of anti-corrosives. So it is really important to keep that happening, so that the anti-corrosives continue to be applied correctly. But also, if there is a continuing problem, people can be alerted that they need to take even more care with filtering, flushing, and other techniques to avoid that lead.
Mm-hmm.
All right. We have another question for Aaron that says, from Nicole Hill. She says, Aaron stated that the Eagle advisory boards should be representative of communities. Why are there no directly impacted people on them? And Eagle reps admitted that they are disconnected from the communities, especially those that are primarily people of color.
Yeah, it's unfortunate. I mean, if you have your handbook handy, section D 4 talks a bit about the actual legal requirements for the water system advisory councils, and then Eagle's recommended best practices. The requirement is that the members that are appointed by the local water department have a demonstrated interest or knowledge about lead in drinking water. And then Eagle then further recommends that there's representation from different cultural, economic, and geographic perspectives on the council. And unfortunately, that best practice just sometimes isn't followed, as we see in Detroit, where they essentially just appointed the pre-existing Board of Water Commissioners to serve as the advisory council. So, I think it's sort of up to us as residents and as watchdogs to hold those advisory councils accountable, and to contact them and really demand more and better representation on those councils. It's unfortunate that it falls, as so much does, that responsibility falls on residents, but I think that's the best way to make sure that those councils are representative of the communities. I hope that answers your question.
That's great, Aaron. I appreciate it. And I would just add that one of the things Freshwater Future is doing, and you heard from Reverend Pinckney, he represents a separate and independent water council. And that's part of what Freshwater Future helps communities create. So if you feel there's not enough pressure on those committees, it is possible to create your own committee that brings pressure, both on what the committee is working toward, but also to say, hey, we need the members of this independent committee to be on this official committee. So we are happy to help create those where you're interested in that. And we'll be talking a bit more about that on the next webinar.
That'll be next week. Same time, same place, right here on Zoom, at 10:30 to noon, where we're going to have some of our current water councils speaking. I did see that Ben said that Flint still does not have a council at all. We are working with the Flint Development Center, who now has a lab, and some of those young people are on today with us. So you'll hear more about that next week. Jill, we have 2 additional questions, and then we're going to start to showcase some information for a call to action.
Excellent. So Dominique Strong from Flint asks, how can we ask for the parts per billion to be lower than 12, which is the number that will be in effect starting in 2025? I don't know if Nick or Aaron want to approach that.
Yeah, I can answer that one. So if we want the level to be lower than 12, then Michigan would have to revise its regulation again. So that's a number that's set by Eagle through its regulation. And so basically what that would mean is Eagle would have to go through the rulemaking process again, which I should mention is subject to a bit of legislative oversight in the state of Michigan. And so the legislature gets to weigh in on sort of in that process, and then would have to justify sort of with scientific evidence lowering the 12 parts per billion standard in Michigan. We think that Michigan could do that under its Safe Drinking Water Act. It's obviously not something that they did here. Under the federal law, why it was set at 15 originally is because federal law actually requires the EPA to consider economic feasibility when setting these limits. So it basically determined that 15 was what water systems could do feasibly given sort of costs. And so, that's largely where that came from. And Michigan obviously lowered it because they thought water systems could do a bit better, but it's obviously still not, a public health figure, which is the problem.
Yeah, excellent. Thanks, Nick. And then we have another question from Ben asking to what extent utilities are required to excavate as part of their inventorying process, and whether hydrovacking is considered to be acceptable.
Yeah, I can answer that. It's the rule is pretty silent about exactly how water systems are to go about conducting their inventories. It doesn't mandate that they take this approach or that approach. Basically just mandates that they do it and they submit the results. And there's been a bit of problems just in sort of doing, just verifying the quality of those assessments. And when I say verifying the quality, I mean verifying essentially the accuracy of them, because I think what we see is a lot of water systems going to the basement, seeing the line that comes into the home and making a determination based off that, but that's not always the best. And most aren't doing sort of excavations, which is the most reliable method of investigation. And so that's a point where residents can really sort of press on their water system and say, like, well, what did you do to sort of find out that I didn't have a lead service line? And was it just, the worst practice would just be like looking at existing records and saying, oh, we determined you don't have a lead service line because we looked at our building code records from like 1930 or something like that. That would be highly unreliable.
Thank
Jill,
you
I
so
think
much.
we have Nicole Hill asked a question about the liners in Detroit. Did you see that?
Oh, right. So it says Detroit is using CIPP liners in some lead service lines in Detroit, and it has been shown that that is not safe, but it is used as an alternative to removal of some of the lead service lines. Can anyone comment on that?
Yeah, unfortunately, I don't really know that much about it. Like I've heard of it, but I can't sort of give a good comment one way or the other about its safety. I haven't looked into it all of that much.
We will definitely continue to look into that, Nicole. And next week may have additional information for you. Alexis, could you please queue up the communities in Michigan, the cities in Michigan that have lead exceedance? And Jill, if you don't mind, as our director, she has directed the work to be focused in these communities to help support what Nick and the center has been doing. Jill, you want to just run through and talk about the importance of this call to action for everyone that is on this call that knows a community member in these particular cities, in your city. Invite them to next week's conversation about the Lead and Copper Rule Handbook. And you see that these are Kalamazoo, Livingston. So Jill, please talk about that importance.
Yes, thank you, Alicia. So when these advisories come out, the cities have to actually inform their residents that they're out of compliance. However, oftentimes that's simply a letter that could be tucked into a bill or something else that could be easily overlooked. And because we have so many cities out of compliance because we're doing better testing, we need people to really help get the word out that, number one, your water could have lead in it, and that could be impacting you and your family. And number two, invite them to come to these webinars so that everybody gets empowered to make sure their water is safe. And one of the things we've seen in Benton Harbor, for example, is although they're 90th percentile, or the number of the lead level where 10% of homes are above and 90% are below, is in the 20s. One home reported through at 440. Now that is probably because of particulate lead in that system. That family may be getting particulate lead not just when the sample happened, but at other times, and that causes a really high concentration to be consumed if you consume that water. And so sometimes these regulations that tell us how we should pay attention to when things are out of compliance, they have to be done in a way that is possible for the cities. You know, you can't test every single house all the time. But what we want to make sure is that people are aware that lead does vary. And lead varies between homes. And so if you're out of compliance in your particular municipality or condo association or whatever public system you're on, it's really important to take the steps to get informed, to protect your family using flushing and filtering, and even consider alternative water supplies when there's construction in the area or when lead service lines are being changed out. So that's why we want to bring people to these webinars, really help them understand this information so that we can all go back and protect our families, protect our communities, and stand together so that municipalities understand what communities want and need.
Wonderful. Thank you so much, Jill. Thank you, Alexis, for showcasing that 26 cities in the state of Michigan are exceeding at an exceeding level of the lead. I want to just talk to you a little bit about the right and the duty. We all have a right to safe, affordable drinking water, but it is our duty to stand up and take action when we see that our governance is not what it should be. Community members, on next week, on Wednesday at 10:30, on this Zoom link that you have registered for. We will have the conversations that need to be had. We will support you in developing water councils. We will provide you with information and resources. The handbook is a tool that you now have. We are in partnership with the center. Let's get the work done. During the time that you were registering, we said that we would have a drawing for a water filter. Each of your public health departments within your cities are responsible for providing you with the water filter if you are at the exceeding sea level of lead. Please contact your water departments. But our winner of our free water filter, Miss Leslie, I would like for you to come on. Leslie is our communications director, and she's going to announce who our winner is. Leslie?
Sure. Hi, everybody. Thanks for participating today and, of course, for registering. Let's see. Our drawing winner is Stacy McFarlane from Mount Clemens. So we will be sending you an email. Congratulations, and get your address details, and we'll send that right off to you. So again, thanks everybody for registering.
Wonderful. And there'll be more wonderful incentives on next week. Great opportunities to have some Q&A. And I believe that we will have Nick and Aaron back with us. Aaron will be going over again and review the handbook. So please do your homework, write your questions down, and we look forward to seeing you on next week. Have a wonderful and safe week and a great weekend. Bye, everyone.
Thank you.
Thank you.